Okay, great. So I want to welcome everybody to another one of our Meet the Candidate forums, specific to early learning and children and families issues. Again, I'm Joel Ryan. I'm the Executive Director of the Washington State Association of Head Start and ECAP. And we are a membership-based organization that represents Head Start and ECAP providers, staff, parents, and of course, we advocate for the children of the program. We have been doing these candidate forums over the last few weeks. Each of them lasts about 30 minutes. We do have a set series of questions that we ask each candidate to make sure it's fair. And if there is time left over, we also open it up for additional questions at the end. Today, we are very excited to have State Senator Ron Muzzall join us. Hopefully I'm pronouncing your name correctly.
No, it's close.
Can you say that again?
It's sort of close. That's all that matters.
Yeah. But we're glad you're joining us today. And, we've been starting these forums by just simply giving you a chance to introduce yourself and what brought you to come out and visit with us at this candidate forum specific to children and families today. So I'll just start there. And again, thanks for joining us.
You bet. Pretty simple, pretty boring. I'm fourth generation here on the farm. There'll be some background noise because the grandkids are just getting up from their naps. They nap here at the house in the afternoons. This is where the offices are for the business. The fifth generation is vested in the farm and is actively involved. Two of our three daughters, and one of them has two daughters. Both couples live on the farm. I've spent 30 years in governance, whether it was nonprofits, church, fire department, agricultural co-ops, and was asked here a year ago, a little over, to put my name in to be appointed for this open position at the time. Have not spent nearly as much time in Olympia as I have at the county courthouse and governance issues, and at the nation's capital, Washington, D.C., involved with lobbying and governance issues. So it's kind of my first foray into state government. I am I'm a fiscal conservative, but only because I feel that that's responsibility of government to the taxpayers. But have always been involved in social issues and seeing that we're taking care of those who are less fortunate or who need a hand up. But I think that pretty well covers it.
Great, thank you. I'm going to turn it over to April, who's going to be our MC for today. The other thing, Senator, I wanted to mention as well is that, we're recording this. We'll send this, I think probably in YouTube, we'll send it to you. You can use it any way you'd like. We also send it out to our members in case you're wondering in terms of how it's being used so people can view it as well.
Mm-hmm.
But April, I'll turn it over to you to get us started.
Yeah, actually, Yuval's here, so I'm going to let him do it since this is his gig.
Oh, cool. Hey, Yuval.
Can you hear me?
I can hear you. You don't have a picture, though. You're pictureless. There you are. There you
I
are.
might be in two places. I'm having a lot of tech problems today. I don't know why. But we'll give this a go from the phone and not from the laptop because this laptop's not working today. Hello. The warm-up question for us today is, since our forum is focused on young children and families, what was your favorite children's book growing up and why?
And I guess it would be children's book, because I read it so many times. I had a particular fascination with Swiss Family Robinson. And it probably had to do with me growing up on the farm and them making do on essentially a deserted island was very disappointed when I saw the movie as a kid because the book was so much better. But that certainly was one of my favorite ones growing up. If it wasn't, probably the other one that I read so many times was Laura Ingalls Wilder's The Farmer Boy. That was another favorite of mine.
Awesome. Thank you so much. And so throughout the forum today, we have a group of parents that will help ask some of the questions. And so first up, we have April.
And actually, I'm going to pass it to Carolyn.
Thank you.
Carolyn, you're on mute.
Oh, I was doing so well. Good evening. Hi, I'm Carolyn. What is your definition of early learning?
Wow. Well, I guess that when we talk, I mean, my definition of early learning is from, I would guess, pre-toddler up, and ensuring that they're ready to enter some sort of a system. They're prepared to enter a system of learning, and it depends, of course, on each child.
Thank you.
Okay, thank you.
All right, guys. Thank you, Senator Muzzall. Research shows that investments in comprehensive early childhood education pay off, particularly for disadvantaged children and families. ECAP is a high-quality, comprehensive early learning program that serves some of the most at-risk families. Do you support increasing ECAP funding? Why or why not?
Yeah, we had a number of ECAP parents, teachers, and the like in the office this last session. And I support ECAP funding all the way across the board. I think that it is the first step toward bringing our educational system up. And I think that we need to really concentrate on bringing our educational system to a higher level. And in order to do that, we've got to start early. And there certainly are a lot of different programs out there, but state funding for some of them are critical.
Thank you.
All right. Child care providers are some of the lowest paid workers, oftentimes making less than a parking lot attendants and dog walkers, while families struggle to afford and find affordable care. What will you do to make child care more affordable after families and increase wages and benefits?
Well, that's a very difficult question because that falls into a lot of arenas. Obviously, our minimum wage is going up. Child care is at a pivotal stage right now because of COVID and because of a number of other things, including some state mandates, which have had a real impact. In our district, our Hispanic community in the Skagit Valley was hit pretty hard this last year with some of the new requirements that were necessary for them to provide childcare. And honestly, some of them just started flying under the radar and not being credited because they couldn't meet those regulations. So there are some real, and I spent some time with a group that was being adversely affected by that. There are lots of suggestions out there on what to do about it. I have not come to a consensus on what the answer is. I understand the problem, but I haven't been convinced on what I would support as an answer to solve the problem that we're looking at. It's another quandary. Every time it seems like we get government involved in something like this, the unintended consequences are such that they create more problems than what we were trying to solve in the beginning. But we're going to have to take a real hard look at funding, of course, but what structure we do that under as far as childcare and then the oversight of childcare. So I wish I could give you a real good answer as to solve the problem, but I don't have it.
Yeah.
All right, thank you. Only 5% of Washington State's eligible families receive home visiting from federal, state, and local funding, leaving many families unserved. What are your plans to support pregnant moms and families with newborn children? Are you going to work towards expanding policies around paid family leave, early ECAP, and home visiting?
Well, first off, we've got to get our paid family leave up and going to the level that it is supposed to be. We started off 2020 with a 10-week wait for paid family and medical leave, which is just completely unacceptable. That was the first faux pas by our Employment Security Department, was the paid family and medical leave. The second was unemployment. We dealt with that in Health and Long-Term Care Committee, and then we did pass through a bill expanding it on the floor of the Senate. And right now, I can't remember how it made it through the House. Over 2,000 bills, they start running together after a while. But I think that we need to be, yes, there is a serious disadvantaged group that need the help prenatal and post, and the state hasn't been living up to its responsibility there, both in funding and as far as programs go. But we've had a real issue with, who is it, HCA? Anyhow, the department that oversees that, getting the program up and running like we had hoped it would. So this next session, I would only assume that we're going to be dealing with it again, getting reports back, but also looking at how we are going to further fund that.
Prior to COVID-19, 1 in 11 children were homeless. Due to the pandemic, we've seen an increase in homeless children and families. What will you do to ensure that children have safe and stable housing?
Wow. I wish I had an answer to that one. That is an extremely complex problem, and there are so many variables. One, we've got a housing shortage. That is problematic because that isn't going to be solved overnight. Two, we've got a homeless issue that is dependent on economics, but also on mental health and substance abuse, sometimes coupled together. Our state has failed when it comes to our mental health crisis, and I believe we've failed when it comes to our substance abuse crisis. And in a lot of cases, that's structure. The counties are taking over a little more responsibility there, and with some state funding, and I'm hoping that we're going to see some positive results from that. But talking to the health departments in the 3 counties, they're overwhelmed, understaffed, and underfunded. So we're going to have to take a real hard look at creating programs that have consistent results, which has been one of the problems that we've had, is actually that. And then bringing all of this together to address homelessness. We've got to prioritize those families, and it's a hard thing to do, but I think it's a necessity. Prioritize those families that have children. Obviously, we've got a homeless crisis that's all the way across the board, but we've got to prioritize those with children. Those are obviously the ones that we're going to have the quickest and more profound results from, are those families with the children, often with single parents. But we're going to have to prioritize them, and that isn't going to be fun. It's a necessity, but it is challenging when we've got so much of an issue to address, to pick out portions of it to help first. But I think we're going to have to prioritize those.
Thank you. Definitely a complex issue.
Yes.
Christiana, you're up next. Are you there?
May have lost her.
Oh, there you are.
I just did unmute myself. I'm sitting here talking and I'm not unmuting myself. It's like, so what will you do to ensure every child has access to the best available medical and mental health and dental care?
Well, that is something that we wrestle with in health and long-term care all the time. We started down a path in 2019 to identify where the costs were coming from in our healthcare system, and I'm backing up here a little ways. So what are the big drivers for costs in the healthcare system? And that included a number of things, but one of them was a drug transparency bill that was passed in 2019. In 2020, we were supposed to have the report on that bill the 1st of March. The end of February, the HCA, Healthcare Authority, got back to us and said, well, it'll probably be September or maybe the end of the year. And we said, well, what have you done? Well, we had a meeting. Well, you were supposed to have it to us the 1st of March. What's the problem? Well, we need more money and we need more people. So even though the legislature is trying to work through the process, the bureaucracy in our state government is problematic to trying to come up with the data and the facts. And honestly, I think this is one of the challenges that I find most frustrating is that even when we have a hearing, we've got conflicting views. And, somebody will come in and say, well, the problem's this, and somebody else will come in and, well, the problem is that, and they're completely opposing. So we've got, excuse me, we've got to figure out, there's usually 3 of them. We've got to figure out what the problem is before we can solve it, and we aren't getting some of the participation we would like there. Once we have that figured out, then we're going to know where to put resources in order to answer the question that you just asked. And we worked on a number of things this last year, and part of them were really timely, like telehealth, because we got that instituted, and we actually had to put an emergency clause on some of them to get them in early because of the COVID crisis, so that we can have doctors serving patients without them having to come into the office. But we're going to have to look at the whole structure of our medical system. We've got a lot, and we're hearing from them, we've got a lot of private practitioners who are saying that they can't stay in business. So whose fault is that? Is it the insurance companies? I think that there's some fault that lies there. Is it, and of course there's 2 insurances there. There's the liability and then there's the patient care. Is it inavailability of insurance? Is it, I've talked to several doctors who have said, I'd like to go just back to a cash basis and I could do it for 1/3 of the cost. But we took a lot of testimony. We took a lot of time dealing with it, and we did not come up with the answer that I was comfortable with on how we're going to accomplish the end goal. So it's a process, and one that's taking entirely too long, but we're only in session for this last year 60 days, this next year 90 or 100, and we're working through it. It isn't just a money thing, because we have had resources to put into it. It's about getting a program that works, and in my opinion, we've really struggled to find that. Way too long an answer, sorry.
You're okay. Thank you.
Okay, next question. Early learning is about 1% of the state's budget. In your opinion, is the state of Washington investing sufficiently in early childhood education?
No.
I love that.
That's it. Yes, it's a good answer.
Yeah. Joel, next question is you.
Well, of course, you know, one thing I want to know, Senator, is we're facing a pretty difficult budget situation in the next legislative session in January. How do you view and what strategies do you think you'll use to try to close that budget deficit? And of course, what I'm after is, are you looking at an all cuts? Are you open to progressive revenue? Both? What do you think? What would be your approach in trying to deal with and wrestle with the budget deficit?
Well, first, I sit on Ways and Means Committee, and we had a meeting here earlier in the week, and we aren't going to be in the budget issue that we thought we were going to be. Our tax receipts are considerably higher than what we had expected them to be. We did, no, I can't say we. The governor made some cuts. He held off on implementation of some things. And so by the time we finish this budget cycle, which will be June, right now we're looking at about a $2.2 billion shortfall, and that's out of a $52 billion budget. So if we continue on the way we're going as far as revenue, and we are seeing a significant cost savings in some of our departments because we're not providing the services. But some of them are good things and some of them are not so good at things, but we're just not spending the money that we normally would under normal conditions. So I'm not sure that we're going to have a huge shortfall in this biennium. The next biennium, we're going to have to see what kind of a recession we have coming on. They're talking second quarter, so after March of 2021 would be the worst part of the recession, but we just don't know at this point in time. We're at about 8% unemployment in the state, which is really good compared to a lot of other states. It's twice what it was pre-COVID, but it isn't nearly as draconian as what we thought. So what I propose is not passing more taxes, but reappropriation. We've got some things that we put into play last legislative session that now the money is starting to come in, because of course you put a new tax in, or you put some new revenue source, although I hate that word because revenue is what business does, taxes are what government does. You put a new source in, it takes 6 months for that to start appearing into your budget. So some of those things that we put into play last session, that money is coming in now. We could reappropriate that and probably cover a good portion of the shortfall. And then there are some things that we're going to probably kick down the road a little bit and just try to see what levels out. I realize there's talk of a capital gains tax, but according to the IRS, that capital gains is income. So even if we were to pass that in 21, then you've got 6 months before you start seeing any of that come in. It's going to end up in court immediately. There will be those who appeal that going off the IRS decision. So we're not going to see that income until 22. And because we won't be out of session and it won't be put into play until June. So we'll be out of session April, May. It won't be put into play till June. We won't see that income until 22. So we're going to have to backfill up front no matter what. And I don't hold much hope, even if the majority passes some sort of a income tax, that we're going to see the money anytime soon. But I actually have pretty high hopes after this last Ways and Means Committee that we're not going to have the kind of shortfall that we have. And my priorities are quite honestly to see that we live up to our responsibilities on our social programs. Once again, way too long an answer.
No, I appreciate it. Thank you for the thoughtful answer. Appreciate them. April, are there any additional questions, or can we open it up to other folks that are on this?
We can open up.
Okay. Well, so is there anyone else out there that would like to ask a question that hasn't been addressed? Follow up on something?
I think we're good.
Okay. Well, that sounds great. So, Senator, I wanted to give you an opportunity to, if you want to take 30 seconds to a minute just to close us out. Any final thoughts or anything else you haven't had?
I spent 23 cumulative years on boards of directors of farm co-ops, from $100 million to $15 billion organizations. During that point in time, I spent a lot of time on either as an auditing officer or on auditing committees. All those organizations were audited every year. I'm appalled by the lack of auditing that we have going on in the state and the malfeasance that we are seeing in our state government. In the last 4 years, we've paid out $518 million in tort claims. And that doesn't even take into effect those in the last few months, including the $98 million one that was supposed to be paid out to the Powell family for the loss of those kids. But $518 million that we've spent in 4 years on tort claims. And that is all sorts of things, from sexual discrimination to paying the victims of an early release prisoner that killed somebody, to one that I know of in our community where the foster care system put a child who had a history of molestation in a home where he molested 2 of the foster parents' kids. Couple that with a $500 million ESD loss, although it looks like we got back about 215 million of that, but that's $1 billion in 4 years that we have lost. That was it wasn't necessary to have that. Our state needs structure, discipline, and accountability in the worst way. And that is one of the things that, we wouldn't need the budget we have if we weren't paying out so much money or losing so much money. And that is one of my priorities, is to create a culture of accountability that we don't have in Olympia.
Oh, thank you very much. Thank you for joining us. Really appreciate it.
You bet.
Thanks for taking all the time.